Could the way you've been urinating your entire life actually be working against you? It's a question most people have never stopped to consider, yet it touches something we do multiple times every day. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you've ever wondered whether sitting or standing makes any real difference to your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to explore what actually happens inside your body depending on how you urinate, and whether one position might truly be better for you than the other. So let's start with something that might surprise you. Not long ago, a research team surveyed over 7,000 men across 13 countries and asked them a simple question. Do you sit or stand when you urinate? The answers were fascinating. In the United States, only about 10% of men said they always sit down to pee. Roughly a third said they never sit, and another 17% said they rarely do. Age didn't seem to make much difference in these patterns, but in Germany, the numbers flipped. About 40% of men there reported sitting every single time, and older men were even more likely to sit. Now, I'll be honest. In one of my earlier videos, I casually mentioned sitting down to urinate as part of a broader discussion about bladder habits, and the responses I got were intense. People wrote in saying, "Who even sits to pee? That's not normal." But here's the truth. Millions of people do. And there are actually some very good reasons why. So let's talk about what really matters here. Not cultural norms or assumptions, but what's happening inside your body when you choose one position over the other. Because whether you've thought about it or not, the way you urinate can have real effects on your pelvic floor, your bladder, and especially your prostate as you age. And understanding those effects can help you make choices that support your long-term urological health. To understand whether sitting or standing makes a difference, we first need to talk about what's actually going on down there when you urinate. Your bladder holds urine until you're ready to release it. When that moment comes, a muscle called the detrusor contracts to push urine out, while another set of muscles, your pelvic floor, needs to relax to let the urine pass through the urethra and out of your body. Now here's where positioning starts to matter. When you're standing, your body naturally recruits some of those pelvic floor muscles just to keep you upright and balanced. It's subtle, but it's there, a baseline level of tension that's part of your posture. When you sit down, that tension eases. Your pelvic floor has a chance to fully relax, which can make urination smoother and more complete. For some people, this difference is minor, but for others, especially those dealing with certain conditions, it can be significant. Let me explain. There's a condition I see quite often in my practice called high-tone pelvic floor dysfunction. This happens when the muscles of your pelvic floor are chronically tense, often due to stress or anxiety. Some people carry tension in their jaw and wake up with headaches. Others carry it in their pelvis. And when your pelvic floor is tight, urination becomes harder. You might feel like you have to strain. You might notice your stream starting and stopping, or a feeling that you can't fully empty your bladder. For people dealing with this, sitting can make a real difference, because it allows those muscles to release in a way that standing often doesn't. But there's another group of people for whom sitting becomes particularly helpful, and that's men over the age of 50. After 50, about half of all men begin to develop something called benign prostatic hyperplasia, or BPH. That's just a medical term for an enlarged prostate. As the prostate grows, it starts to press on the urethra, the tube that carries urine out of your body. It's almost like trying to drink through a straw that's been pinched in the middle. The narrower the passage, the harder it is for urine to flow. By the time men reach 80, about 80% of them have some degree of prostate enlargement, and the symptoms can be frustrating. You might notice that you have to wait longer for your stream to start. Your flow might be weaker than it used to be. You might feel like you're never quite finished, or you might dribble afterward. Some men find themselves straining just to empty their bladder. And here's where sitting becomes more than just a preference. It becomes a practical solution. When you sit, your pelvic floor relaxes more completely. That relaxation can help compensate for the narrowing caused by an enlarged prostate, allowing urine to flow more easily. There's also a hygiene factor. If your stream is weak or unpredictable, sitting simply makes things easier and cleaner. But let's not just rely on theory. Let's talk about what the research actually shows. One study looked specifically at men with BPH and compared their urination patterns when sitting versus standing. What they found was striking. Men with BPH who sat down had higher flow rates, meaning their urine came out faster. They also voided more urine during each trip to the bathroom, and they left less behind in their bladder afterward. We call that leftover urine the post-void residual, and the less of it you have, the better. Interestingly, men without BPH didn't see the same benefits. For them, sitting or standing didn't make much of a measurable difference. But if you're over 50 or if you're starting to notice any urinary symptoms, hesitancy, weak flow, dribbling, frequent nighttime trips, then sitting might genuinely help. Now, you might be wondering, if sitting has these potential benefits, why don't more people do it? Well, another study surveyed nearly 200 men in the US and asked them exactly that. Of the men who preferred to sit, many reported having urinary symptoms that bothered them. Others had physical limitations, recent surgery, back pain, arthritis, that made standing uncomfortable. But there was also a group who simply found sitting more comfortable, more hygienic, or more convenient, especially at night. On the flip side, many of the men who preferred to stand said it felt more natural, more masculine, or just more familiar. For some, standing was tied to their sense of identity. And that's okay too. What I want you to take away from this is that there's no one-size-fits-all answer. Your body, your symptoms, and your comfort matter most. So where does that leave us? If you're a younger man with no urinary symptoms and you prefer to stand, there's no medical reason to change what you're doing. Your body is functioning well, and you should do what feels natural. But if you're noticing changes, if it takes longer to start urinating, if your stream feels weaker, if you're getting up multiple times at night, or if you're dealing with dribbling afterward, then it's worth trying to sit for a week or two and see if it makes a difference. You might be surprised. And if you're over 50, even if you don't have obvious symptoms yet, sitting can be a gentle, proactive way to support your urological health as your prostate naturally changes with age. Now, I also want to address something I see people doing more and more, bringing their phone into the bathroom and scrolling while they sit. I understand the temptation, but spending too much time on the toilet, whether you're reading, scrolling, or just lingering, can actually create problems. It puts unnecessary pressure on your pelvic floor and can contribute to issues like hemorrhoids or pelvic discomfort. So if you do sit, make it purposeful. Empty your bladder and then move on. And if you're someone who's been dealing with urinary symptoms for a while, if you've noticed persistent hesitancy, straining, or incomplete emptying, please talk to a urologist. There are many treatment options available for BPH and pelvic floor dysfunction, from lifestyle changes and medications to minimally invasive procedures. You don't have to live with discomfort or frustration. The key is not to ignore what your body is telling you. At the end of the day, this isn't about whether sitting or standing is right or wrong. It's about understanding your body and making choices that support your health and comfort. If sitting helps you urinate more completely, if it eases symptoms you've been living with, or if it simply feels better, then it's the right choice for you. And if standing works well and you're not experiencing any issues, then there's no need to change. What matters is that you're paying attention, that you're listening to your body, and that you're willing to adapt when something isn't working the way it used to. Your urological health is part of your overall well-being, and small adjustments, like how you position yourself when you urinate, can make a meaningful difference over time. So give yourself permission to do what feels right. And if you're ever unsure, or if symptoms persist, reach out to a urologist who can guide you with care and expertise. Thank you so much for being here today. If this video helped you see things a little more clearly, I'd love for you to subscribe and share it with someone who might benefit. And as always, remember to take care of yourself, because you are absolutely worth it.